Welcome to the Medical Device Made Easy podcast. Here is Munir Elazouzi from easymedicaldevice.com, and today we'll talk about risk management and we'll help you to understand more about risk management and also more about how to build the project, the team, or everything about your risk management. Because it's always a topic that is a bit difficult to understand. We ask everybody, I ask all my customers, you should have a risk management, and then the next question is what is this? How should I start? Where should I start? And for that, I have an expert with me, which is Bijan Elahi. So, Bijan, welcome to the Medical Device Made Easy podcast.
Hi, Monir. Yeah, good to be here. How are you?
Thank you. Thank you for being here. I'm really great. Happy to have you also because, as we said, you are really an expert. You are an author of some books on risk management and you are also planning some conference. So, just maybe a small introduction of yourself so people that don't know you better.
Okay. Yeah, I have been in the risk management space for a long, long time. Originally in aerospace at NASA, the spacecraft safety, and then in the past 30 some years in the MedTech. So it's been quite a while. And I started working in risk management even before there was the standard. ISO 14971 had not even been created yet. And ever since then, things have gotten more formal, more organized all across the industry. And a few years ago, I wrote a book on the subject, which is now used widely by both professionals as a reference and also in universities as a reference, a textbook. The book has been released in two editions. The latest edition came out after the last edition of ISO 14971 was released. So yeah, that's I teach courses, and I now am working on organizing a conference in Europe.
Great. We'll talk about the conference at the end. Mainly, as said at the beginning, we have some manufacturers or customers that are here and they are really like, I want to make a risk management because my consultant asked me to do that, or because no, my notified body says I need to do that, or because I have to do that. So the first question maybe I want to ask you is mainly if you have this company and you have to advise them, where do they start? Where should they start? So what is the first thing that they should do to then organize this project? Because it's really a project to create this risk management file.
Right. Yeah. So risk management has to be done in a formal way according to ISO 14971. This is a recognized standard worldwide. The standard requires that you have a risk management system and a risk management process. So you need to establish all of those. A risk management process is typically captured in an SOP or standard operating procedure in most companies. And in my experience, a lot of companies have an owner of this process which works in the quality department.
Yeah.
And so that's the start. You have to have a process and make sure that your people understand it and know how to use it. That's also important. And then when you start is the best place to start is in the early phases of product development when you have a concept, because as you know, in any endeavor, the later you try to fix problems and make changes, the more expensive it is, and sometimes it's also impossible. So as soon as you have your concept for your medical device, it's best to start thinking about risk management, what aspects of it are most critical, and start building in features in your designs that address safety of patients and users.
Exactly, yeah, because mainly I know that we have some companies that arrive at the end of their design, and then we say, "Oh, have you done a risk management?" They say, "Oh no, we haven't. What is that exactly?" And when we are starting to explain to them, and even when we are starting to list the risk that may exist with their products, they find out that they haven't considered those risks, and then, as you've said, it will cost them more money to come back to maybe redesign or retest or redo things, etc., which also can create some problems. So here, do you have some, if I can say, techniques or mainly tools that are commonly used by some professionals in risk management? So something that can help maybe the audience to search about them, or maybe you have them also on your book. I don't know, but maybe it can be
Yeah.
something also to check.
Yes, yes to all of the above. There are some popular techniques and tools that people use for risk management. The most common one is failure modes and effects analysis. People also use fault tree analysis or HAZOP, depending on their device. But FMEA or failure modes and effects analysis is the most common one. And it is mentioned in the standard ISO 14971 and ISO TR 24971. use of any of these tools and techniques is not mandatory. These are just suggested by the standard. In my book, I also talk about it. I have a long chapter actually about FMEAs, which are very commonly used. The only thing is that it's not sufficient to just do an FMEA. A lot of companies, especially younger ones, may think that an FMEA is enough. But an FMEA is a failure modes and effects analysis, which looks for safety factors related to failures of a medical device. But as we all know, medical devices can also present hazards when the device is working exactly as it should and there is nothing broken. So FMEA will miss that. That's why it's better to do fault tree analysis and FMEA together. There's also preliminary hazard analysis and other technique that people can use. So these are the most commonly used tools. And then there are also software products that support you on these things, and a number of them on the field available.
Exactly, yeah, because we had made a previous episode where we said, is FMEA mandatory? And yeah, the answer is mainly no, it's just a suggestion. But yeah,
Yeah.
I think it's interesting to say, yes, FMEA is just looking at errors that can happen while it's not working. But here it's more about it's working and there is still an error. So what mainly can do is, these are things that are really, I think, important to consider here. So
Yes.
by doing that mainly, so you are making that and you are presenting that to your notified body or regulators or all those people. So what if we come back and we think now at the end to say, oh, what will satisfy those people? So what are they expecting by looking at those documents? Because you will present that to them. What are they looking? Unless to say, yes, I see there is an FMEA, there is a plan, there is a report. Okay, it's fine, you have done it. No, what exactly will they look inside to say you are good or no? There is some misses here.
Unearth the pulse of the medtech world with MedTech Conf, a dynamic platform featuring global events on medical devices, biologicals, IVD, and pharmaceuticals. Stay informed, stay ahead, connect, share, and elevate your knowledge. Become an official sponsor. Make your event shine on the map. MedTech Conf, your key to the medtech universe. Remember, the future is now, and it's at your fingertips with MedTech Conf.
Right. So if you think about it, if you can put yourself in the shoes of the notified body or a regulator, when they receive your risk management report, they have to make a decision as to whether to approve your device or not. So you need to be able to persuade them with enough solid, valid information to make them comfortable to say yes to you. I always tell my students or my clients too that make it easy to understand and read, write a nice report for them, which is not like too much information or also not too little information. So the things that they look for, that they want to make sure that you have considered the operating conditions of your device, who is going to use it, what are the intended purposes and uses for that device, and then have you identified the hazards? Did you follow a good process to identify the hazards? Do you know what your hazardous conditions are? And what pathways are there to those hazardous conditions? Do you know what harms can happen from your device? Do you know what the risks are from your device? And risk is the probability of the harm happening. And then what have you done to reduce those risks? And then the things that you have done to reduce those risks, have you verified that they actually do something, that they work? So these are the things you need to show. And also in the end, they want to make sure that you have addressed the benefit risk balance, because
Yeah.
all medical devices have some risks and have some benefits, but the benefits should outweigh the risks. So you need to be able to persuade them that, in fact, the benefits of this device outweigh its risks.
Yeah, because sometimes, yeah, when you are making this exercise of proving the benefit is higher than the risk, it's like, oh, it makes sense. Look, it makes sense. But you have really, as you said, to convince them and to explain to them that here is why it
Yeah,
makes sense and here is why there is a risk. For example, let's say a risk of infection. But if we don't do that, there is maybe the benefit is the fact that they will not die. So many, if we don't do it, they will die. So it's mainly also something that to balance a bit there. Um,
yeah,
in terms of this, so mainly we have this team now that, I mean, this team, you have this company that is now kind of ready to start this project. They understand why they have to do that. The most difficult part is to start. When I say start, is not just to plan it, is to think, okay, why now I should start and should do maybe a first session or brainstorming or I don't know
yeah.
what to think. So who, how you will build this team of people? Because this is also the issue. We have a lot of companies that say, "Oh, I have to do it." So as you mentioned before, the quality is usually trying to own that, but at the end, the quality is the one that is doing it alone, if I can say so. But this is for me not the right way to do it. So what is your suggestion in terms of who should be part of this risk management exercise?
You always need a leader because, like any effort, you need somebody to lead the effort. It doesn't mean they have to do the whole work by themselves, but they should lead the effort. And as I said, in a lot of companies, quality assurance is the department that owns and leads it. But I also think systems engineering is another good group that could be leading it because systems engineering has the biggest, broadest knowledge of how a medical device is built and used. So I say either these two groups, and then they need to enlist the help of other people in the organization because risk management is a team sport. There is no one department that can know enough to really answer the question. So they should enlist people, mechanical engineering, software engineering, electrical engineering, human factors, toxicology, material science, regulatory, medical safety. Clinical people, all of these people have to come together and work together to be able to really do a good job on risk management.
So when we are talking about that, we talk mainly about corporate companies. But if we are really a small business where we have maybe two, three people, if I can say, mainly
Yeah,
it's a bit more difficult to do this big organization here. So
that's
um,
true. Yeah,
it's mainly the exercise where people, I think first people maybe should be trained first about how this is working and do it. But yeah, the point is, as you mentioned, you should find the specialist or the people that are really knowledgeable about the device. And
yeah,
sometimes, yeah, quality can lead in terms of the process and how it's working because they know the standard and other things. But yeah, the exercise that is difficult is to brainstorm and find out those potential issues that are happening. And yeah,
yeah,
this is sometimes a never-ending story because you start to think a bit too high or too long, or say, oh, it can be killed because of that. But yeah, the chance of happening is really, really, really low. But this is mainly what you have to capture and show that also. So there are a lot of yeah, a lot
yeah.
of risk about involving maybe the wrong people or involving too less people. But is there also an advice maybe to provide some consultants to help on all these exercises?
Yeah. So, when you're even a small company, let's say a 3 or 4 person company, they would hire consultants, they would hire external experts because, with 3 or 4 people, you can't really make a medical device. Who's going to manufacture it for you, right? You need to have skills. So what happens is that these people hire skills. Maybe you'll hire a mechanical engineer to design your device. Maybe you'll hire a software engineer. They may not be on your staff, but they may be consultants that help you. You may hire an external manufacturer to manufacture. So these are human beings. You can enlist them to come and work with you on the risk management. For example, a manufacturing engineer may design the manufacturing process so they know how this is going to be built. They can then talk with your risk management team as to what are the risks with respect to manufacturing, what can go wrong that could affect the safety of patients. So these people exist. You just have to bring them in.
And because before also when we talk about corporate, you talked about a lot of functions like when we have a meeting and when there is more than maybe five, six people, it starts to have like a night. It's a nightmare, that kind of meeting. So are we also thinking of making some groups to say, oh, first session we do it with clinical, second session with engineering or technical, third session with marketing or whatever? I mean,
Yeah.
is this like an exercise that also is advised?
Right. And this is the job of the leader, the risk manager, perhaps the quality person, but whoever is the process owner and the leader, I think that's what you said is actually very smart. You don't want to bring 15, 16 people in the room where only 2 people or 3 people are talking and the rest of them are sitting there listening and maybe they're even getting bored. Sometimes it's best to bring people at the right time when their skills are needed. So if I'm going to be discussing, for example, a failure modes and effects analysis on the mechanical aspects of the device, I don't need my toxicologist
Yeah.
or my regulator to be in the room. I can call them later. But at the right, so that this is the efficiency of the process, how you bring people at what time, you can best use their time. Yeah.
Exactly, yeah. And mainly, if you had to say to somebody, because when we do, for example, a clinical investigation, we are defining what we call an endpoint. So mainly what we are trying to find out at the end. So what will be here the endpoint, if I can say, of this, and when we can say we have achieved our objective and we reached the endpoint? Because I said it can be a never-ending story, and you can spend hours and hours or days and days to try to find more issues or more potential issues. But where are we? When are we stopping, if I can say?
Hey, just a second. Do you need a EU, Swiss or UK representative? Then choose Easy Medical Device. We can represent you and also become your importer. Contact us at eo@easymedicaldevice.com.
Yeah, you're right. You could keep going. As you know, risk management is expected to be a never-ending
Yeah.
process. As long as the product exists, you should keep at it. But for pre-market risk management, before you finish your work and release it or submit it for approval, the point that I think that you can consider that is good enough, is finished, that you can submit it, is when you feel that you have captured all the hazards of your device, you understand the hazardous situations and the harms, and you have been able to write a believable, persuasive benefit risk analysis. When you have all this information in place, and of course you have to have supporting information like your risk controls verification, so that you can prove with data that the risk controls actually work and they're effective. So those are the side information that you can include in your risk management file. Don't have to be in the report, but in the report you have to ensure that the product is properly described, is intended use is described. Hazards have been identified, hazardous situations, harms. You know what is the overall residual risk of the device. That's another important thing, because to a regulator or to a patient, what matters is the overall residual risk of the device. They want to know, what is this device in totality is going to do to me, right? It's the whole device. It's not just individual hazards, it's the whole thing. And then, do the overall benefits of this device outweigh the overall residual risk of this device? If you have all of this, then you're ready to submit.
Exactly, yeah. And uh, because I like the thing that you said about having a great summary, because I received also sometime a risk management files, and as you said, what we receive usually is an FMEA table, like here is my risk management file with everything, but then I have to do my analyze myself to summarize everything. But when I have a report, I like those reports where you say, when the FMEA, you have the before and the after, before mitigation, after mitigation. And when you make the report, you have the first table of before we had 13 risks that were unacceptable, 10 risks that are middle, and 5 risks that were good. And after the mitigation, we have now invert everything. So now we have 0 risks that is unacceptable, etc. So they give a summary of this. You see the residual risks also, and you see then why those residual risks are still acceptable, or why they are fine per the benefits mainly. So yeah, this is something that is really helpful, to have a report at the end that is really summarizing, explaining, and as you mentioned, convincing also, because your objective is not just to give a table, okay, and say to the notified body, okay, here is a table, manage. Guess what you want about it, if I can say.
Yeah,
Here is
go
me
figure
who
it
should
out.
I should drive the story and should drive the thing, and say, here is why you should accept what I'm providing to you because of that. Um,
Yeah.
do you have any resources maybe for people that are still wanting to, maybe, because you talked about the ISO 14971, we have your book. I think we will put also the link on the show notes. Is there any other things that maybe people should do to improve themselves on the creation of this kind of process?
Well, I think, besides the written resources like the standard or my book, and the other resources as well, I think taking some seminars, some courses to get more insights into how to actually do the risk management, that is useful. There are a number of courses, many instructors that are available out there. I teach courses myself. And then there are some guidances. I say the technical reports like ISO TR 24971. That's a good one. There's a new one that's going to be coming out, ISO TR 24971-2, which
Okay.
is going to be about AI
Okay.
and machine learning. It's in the draft form right now, but I think it should be released in the next few months. And these are great resources to access. And then come to conferences, and then podcasts like yours. There are forums that people talk to each other. You can talk to other people who are in the same situation and ask their experience. What have you done? What has worked for you? And people help each other.
Exactly. And when you mention conferences, because as I said at the beginning, you are also organizing a conference. And if I remember, because we talked about this conference, it's in two parts. You have the first part where it's more teaching also, and you have the
Yeah.
second part where it's more networking conferences where we discuss everything. So can you maybe describe, maybe it will give some people what would like to go and see that. So can you describe a bit of how it will be working?
Oh yeah, I'd be happy to. So yeah, the conference itself is 2 days, April 24th and 25th in Amsterdam. But we added an extra day, one day before the conference, which is Wednesday, the 23rd of April, which is all about education. We have 16 hours of tutorials and workshops that you can participate in, and for a very low price, only 199 euros. We have seven excellent instructors that have volunteered to come and teach. You can take any of these courses, as many as you want, just basically for one fee. Then the conference starts itself on Thursday, the 24th of April. And we have a lot of excellent keynote speakers. We have 20 experts that are going to talk about a number of topics. The hottest topics, for example, about a quarter, 25% of our speakers are going to talk about AI, ML, applications of AI in risk management and in medical safety, which is a hot topic. We'll have people that are going to talk about cybersecurity. Post-market risk management is also another area that some companies have struggles, because it's difficult. How do you handle situations if something goes wrong in the field, decision making, vigilance, all those. So we have several talks. We have 20 speakers that are going to speak in two tracks. And then at the end of it, and this is, I think, also like a nice, what we call icing on the cake, and to make it even extra sweet, is at the end of the day, second day, we'll have several roundtable technical discussions where individuals will lead discussions on particular topics of interest. We'll identify each of those topics. It's going to have its own room. The speaker will be there, and then as many people as they like, they can go into those rooms and talk to each other. This will be more of a level discussion. It's not going to be like a presentation to the group.
Yeah.
The group talks to each other. They learn from each other. They learn to collaborate, and they make connections that they can continue after the conference to tackle those issues that are interesting to them.
So to summarize, mainly, if you are really interested by risk management, by also AI, ML, etc., so this is the place to be, because mainly within 3 days, you have a combo of tutorial training, etc., and discussion with a lot of the teachers, and networking, and asking all your questions also, and seeing mainly what are the hot topics also, as you mentioned that. So really recommend it to the people, and we'll put everything on the show notes. So again, what are the dates? The 23rd, 24th, and 25th, correct?
That's
April.
right, of April in Amsterdam.
Okay, so you are flying from the US, because you are in the US, and you fly from the US to Europe for doing all that.
I
So
am. I am, yeah.
is actually, so there are, as you said, there are some teachers, there are some speakers, there are also networking with people. Any names that maybe I know? I don't know if there is some people that
Yeah, Jos van Vroonhoven. I don't know if you know him.
what's the name
He's
again?
Jos van Vroonhoven.
Yeah.
Yeah, he's going to be there. He's going to, of course, he's the convener of ISO 14971 Technical Committee TC 210. And he's going to come and talk to us about the future of ISO 14971.
Okay.
What's going to be happening? So this is very nice to know. We have a number of MedTech leading voices, 100 of which you're one yourself.
Exactly.
We have four of the leading voice speakers that are going to be there. Michelle Lott, maybe some of you know her.
We know
We
her.
have the FDA has committed 2 speakers to talk about cybersecurity and what is good in what they consider good in risk management and in submissions. We have a person from TUV, Tuv Sud, that's going to come and speak about the issues they typically see with submissions in Europe, so you can learn about that. We have vice presidents of Medtronic and Philips will be there. So you're going to be able to network with some high-level people, some influential people. It's going to be exciting because we did this last year in 2024, and the vibe, the energy was just amazing. People were so excited and they loved it. So we said, we have to do this again. And now the conference has grown fourfold. It was 1 day, 1 track last time. Now it's 2 days, 2 tracks. So it's 4 times bigger and plus a day of education.
So great. So I recommend people to go there. Yeah, if you are in the region, if you are in Amsterdam and you want to join, really, it's I think a good place. I will put anyway all the details on the show notes. I mean the links of the event on the show notes. And yeah, and also put the links maybe of your book, of your content or your material that people also can visit that. And yeah, maybe they can also contact you on LinkedIn if they have any questions. So that helpful.
Feel free to reach out to me. Please put my email in your show notes too. You can reach out to me, contact me if you have any questions or need help or whatever. I'm here for you.
Great. Okay, so Bijan, really thank you. I think it was really helpful, and I hope it will help any companies that are starting with this process of risk management to have a kind of an overview of how it should look like, if I can say in the big picture. But yeah, maybe having also some training like these ones that we were talking about, or some expert to help you are also beneficial, because that's can really accelerate your journey and avoid you to make some mistakes also during this journey. Okay, Bijan, so it was really a pleasure. Thank you very much again, and I wish you a nice day.
Thank you, Munir. Yeah, thank you. Bye-bye.
Thank you. Bye.